Hello my people, remember we are still talking about children with children. Msisahau huyu mtoto sasa, as you follow our series, our child now amefika 9 months and she's giving birth now. You remember this our 8 or 10 or 11 year old, aliozwa mapema, she got married at a very early age and now we have rescued her. So after rescuing her, after training her to go for the clinics, to attend the antenatal care, because we want her to have a safe motherhood. We want her to be safe, to be protected, and to feel safe with this newborn. So we are here now today discussing now 9 months imefika, she's in the clinic and she has given birth to that baby. So what happens to this child with a child? Remember, this is not a woman we are talking about, a full-grown woman. We are talking about that small child who is 8, 10, the uterus has ruptured or the uterus has gone other things, but we are praying and trusting that this child will have a normal birth and there will be no these complications that we're talking about. So remember, you need to subscribe to our YouTube channel. You need to subscribe to all our social media. After to Moses Basket Initiative and subscribe and you will be okay. For YouTube, you remember Phyllis Shiko is the name. So as we go by, we will now talk about after birth. This child is in the hospital or bahati mbaya tulimwacha kwa kijiji, she has given birth with the midwife. So the aftercare program is very important. Now we teach the young girl, now that you have given birth, number one is how are her emotions, her mental stability. How is she handling this? Ujue bado mtoto ako na stress. Amepata kiumbe ingine hapa. So the first check is how is she dealing with her facial expression will tell us kwamba ako vizuri ama ako kaput. So even before now mtoto ameshachukuliwa na nurses ama amechukuliwa na midwife, we remain with the girl. She's still bleeding. So that is also what we need to train her to mwambie sasa, you are a mother. Welcome to motherhood. And you can imagine this name mother ni kitu kubwa sana kwake. So she even doesn't understand what you're saying. She's a mother. So Sahindi ameona ule mtoto na ameona huyo mtoto akiwa hapo na ni wake, tunamwambia huyu mtoto ni wako. So the emotions, the mental stability, the stress she's having, we have to be very careful as counselors to make sure she's stable first. Then we go now to the medical issues. How is she bleeding? Atapona aje? Jo sasa huyu ni mtoto. Ujue kuna wengine wana scream, akiona tu hivyo damu ana scream. So that is also after birth. How is she taking care of herself? So tunamwambia haya, unajua sasa what happened is ABCD. Maybe she had a third degree tear or maybe she had a tear. So again, tunamwambia sasa you need now to learn how to take care of the wound. So huyu mtoto bado anashanga what is the wound all about? Kwa nini nasikia uchungu? It is the tear that because you remember the vaginal muscles are not in proper condition. Hakuwa amegrow. So hakuwa the muscles overstretched itself. So huyu mtoto kama amepea na normal birth, the tear is so big na ameshonwa na anasikia uchungu. Kama ni mtoto mwenye tulishindwa kuzalisha, then this means huyu mtoto wetu, we need now, it's a cesarean section. So how does she handle the wound? You remember, hajui amekatwa into 2, a bikini 1. So hajui, hajaelewa, anasikia uchungu. She needs, maybe amekuwa seducted, maybe amekuwa tu hivyo. So that wound, how does this child, nataka ujiweke kwa hiyo viatu. If you're a kid and you have these 2 type of birth, you have normal or cesarean, and you have the 2 tears, how do you handle that? So all this, you remember, it is double stress to this child. This girl is deeply depressed with the whole situation. So after that, tukishamuonesha, you remember also the womb ilikuwa hapa. So the womb needs to start contract. Ianze kujileta polepole ikirudi. So again, she's worried on about the big stomach. Mtoto ametoka, the baby is out. So what next? So will my womb continue being like this? Those are the questions they ask. What will happen to my womb? So you need to learn and tell the kid, okay, now we need to tie up the womb so that it can go back to its normal level of stomach. Again, you see another depressor. That is the womb. Apart from the tears, apart from the wounds, and now she has to deal with the womb contractions to bring it back to normal. So all these have to be done when she's in the hospital, all that tiny dispensary, or with the midwife, ule mkunga wa pale nyumbani. If that is why we were saying last time, if mkunga has no skills, has no knowledge, then we are here we are going to destroy the stomach. And that is why when you look at these young girls, wengi wao, the children, you'll find their stomachs, their lining of their stomach or upper juu imejikunja sana and is still black. Why? Because nobody was telling them on how to tie back the womb to be normal. So she will have a sagging stomach, a sagging skin after childbirth. Who will she blame? She'll be angry that her shape has been destroyed. She'll be bitter. She will even hate the child. And that is why we don't want this child to go to postpartum depression. So we try our best. Kwa hii level yenye tuko na hawa watoto, hapa penye tuko, tuwe tuko sawa kwanza. The acceptance. So we are dealing with her, accepting that now she is a mother, and now the baby is here, and now she has the wounds, and now she has to heal, and now the womb has to come back. And again, we need her emotionally to be stable and mentally stable to be able to look at the baby. That is what we call aftercare of the birth. So sisi wengine huku tutaambiwa, go, ukiwa huku town, Nairobi, wherever, utaambiwa ununua seat bus, sit on what. Hapana, sisi pale ni karai, mtoto akalie maji moto, bas. Every morning, every evening, ajue kujiosha mwenyewe. And remember, even that basin to get is a task. And remember, this girl is dealing with a lot at the same time. So we are happy that some of these dispensaries do offer the basins. And that is where Moses Basket comes in. Tunamwambia, hata kama hakuna karai, now but you have baby clothes that we can give you, uanze maisha. So what do they use? So wengine wataniuliza, Phyllis na wanatumia nini? Wanatumia tu mkebe zile zimetupwa kwa kijiji. That is what we will use. We will train her because now hiyo ndio circumstance iko pale. Because atatoa wapi hiyo maji moto? Atatoa wapi hiyo mkebe? So wakati wewe unatupa mkebe huko, that is what they used to boil water with and sit on it. They don't have salt. Sit on that salt. So what do we result? Into herbs, because they know 1 or 2 herbs that can treat them. But in case all goes worse, what does that tell you? This child, kama alizaa na mkunga ama nini, she'll get infections, she will get sick, she will die literally in the community. Because ataoza. Hakuna. Now remember, ile circumstance iko pale nyumbani, she is a 5th or 6th wife to somebody. So who cares? Nobody cares. So that is why it is important for us as an organization to make sure that this afterbirth, ameshaza huyu mtoto. We are there with her, that journey. We are not looking at the baby first. We are interested with the mother first to survive. Because we know the baby ako kwa Moses Basket, ametulia amelala. But this child, we need her to be sober, to be able to take care of that child. Hayo machache, keep joining me as we go on with this series. Asanteni sana.